I am literally giggly about having you on our show. Our audience is going to absolutely love you. Sharon Lambert, welcome.
Thank you so much for inviting me, Sue.
So if we can just dive right in, you've talked about poverty being trauma. So can you use that as a launching pad to just begin to share some of your thoughts about the intersection of the field of trauma and also the interventions, trauma interventions, and class and poverty?
So we've known for a long time in psychology that there's a significant amount of people who live in poverty experience mental health difficulties. And sometimes when you read the literature, it can say things like, what came first, the mental health or the poverty? But we know that it's the poverty came first. So what's really interesting is I studied psychology for 7 years in university, and I learned about the etiology of loads of different mental health disorders. And never once did I read that poverty was an etiology for a mental health disorder, when it's probably one of the biggest predictors for depression and substance use disorder. So when we talk about trauma, people tend to think about those big T's, the abuse, neglect, and violence, but we know that there's also the small T's. So a small T of living in poverty, being stressed all day, every day, if you're a parent, impacts on your mental health. And if your mental health is impacted and you're living in a situation that is really stressful and you can't access the resources that you need, then that impacts on your kids' mental health too. And then we can meet those children. And if we want to talk about class, if we want to talk about being working class, so if I have a child and I'm struggling with poverty and worrying about paying the bills, and I'm really stressed, and then the kids are really stressed, and if one of them is playing up at school and somebody says, oh, they need to see a mental health professional, when you bring a working class kid in to meet a mental health professional, they're probably going to be a white middle class or upper middle class person. So you look different and you sound different. And sometimes children behave even more agitated than in that context. So then we can very easily focus in on the behavior and forget about what's going on with this family. Why have they ended up here? And the thing is that when you're poor, everything is more difficult.
Right. I think of it like our show talks a lot about attachment as a trajectory, that these early experiences with parents lay down some biology that then it's not the end of the story, but it sets you on a trajectory. I'm thinking of it in this context too, that if you are very poor and you're the child, your parents are very stressed. They are thinking about the paycheck to paycheck, keeping the house, the utilities on, things like that. They're not going to have the same bandwidth, the resilience, the things that we promote with parents around mirroring and attunement and things like that. It's going to be a lot harder. And then, so these kids start off with less vocabulary typically and with a very different experience, and then hit the school systems again with this. I'm thinking of it as a trajectory, because then there's the self-perpetuating problem where that people don't understand what they're seeing and then assume that means something negative about the child versus about the child's environment. Is that in the ballpark?
Yeah. When we talk about some of the things that we talk about that are mental health interventions or parenting interventions come from place of practice, but very often from people who may not have lived in poverty. I'm a university lecturer, so if I am having a difficult time because I'm stressed about something, I can tap into myself and say, I know that I'm really stressed. That can impact on my children. I need to regulate myself a bit more. So that's quite an easy thing to do. If I'm somebody who's had very limited access to education and I don't have the resources, so if I'm really stressed, I don't have the resources to help me out, talking to somebody in that situation about regulating your own emotions when life is really crap. And we hear people all the time as well about blaming people in poverty, saying, oh, why do they drink and why do they smoke if they've got no money? Because you can't do long-term thinking. You're really stressed. So you're not sitting at home thinking, oh, I need to save those $5 that I have left over at the end of the week from my kids' college fund, because your kids are not going to go to college and you don't know if you're going to be alive in 5 or 6 years' time. So you're just surviving day to day. And it is that trajectory thing. So you come home, you have this little baby, you don't have access to external resources or external resources. And then that kid goes to school. I was actually talking to somebody this weekend about what it was like to be poor when you're a child and you're going to school. And they were talking about how their mother used to get a lady to knit their sweater. There was this big color sweater for school, and she couldn't buy it from the store that sold these branded sweaters. So she used to get this lady to knit it. And this lady had a knitting machine, and she knitted up the jumper, but she ran out of wool when she was doing the second sleeve. So this kid came into school with a sleeve that was a slightly different. It was a burgundy colored sweater, but one sleeve was slightly different burgundy. And she got in trouble in school for not having a standard sweater. So there you have a child who's being shamed, who's being punished because they're living in poverty, and the impact that has on your self-esteem. So we know that when you go to school, if you want to be able to learn and you want to be able to receive information, if your fight or flight response system is activated, then you don't have enough activity going on in your thinking brain, and you're not going to be able to learn. So you might become withdrawn, or you might become agitated, whatever your stress response is, and then you'll be punished for having a stress response. So you end up in this cycle of shame and punishment, all because of the stress of poverty and people not understanding what it's really like to be poor.
And not knowing that's happening. So you're internalizing that that's about you. You're just assuming that the reactions and the negative looks you're getting are about you. How is it for you to talk? Like, I'm just all of a sudden aware, as a white privileged woman with some education and some lots of privilege, this is part of why I was so happy to get a guest on. I want to be able to talk about this in a way that is sensitive and accurate. And yeah, so just what is that part like for you?
Yeah, so I suppose I am from poverty. I am from a working class family. My mother was a single parent who raised 2 kids. So we lived in social housing. I get what it's like to be poor. There's often these conversations about the way activism, therapy, interventions, about how they don't understand class. And if you take, for example, climate justice as an example, a couple of weeks ago, there was some protesters, and I'm happy to go out and protest about the climate crisis. But I saw one online where they had gone into a store and they were spilling milk because they want to encourage plant-based diets. And what was really interesting was talking to my friends, was those who were from a middle-class background thought, oh, that's really powerful activism because it has generated interest. If you talk to people from working-class backgrounds and people who were very poor, we were horrified because we know what it's like to not have any milk, or to have 1 carton of milk and to watch your mother cry if that milk has accidentally been spilt over, because you know that there is no more money today to buy another carton of milk. So I guess as a psychologist, I got to go to university. This wouldn't happen in America. So in Ireland, we have free education. So I got a degree and I got a PhD, and it cost me maybe €2,000 to get a degree and a PhD. I don't have to pay that back. That's how much it cost me. And I don't have to, everything else is funded. You got fees and you get a grant and all that kind of thing. So it's easier for people in Ireland to benefit from social mobility than it is in the States. If I had been born in the States, I would not have gone to university, because that would not have been something that would be accessible to me. So I guess then that means that I have a privilege, because I've had the privilege of an access to education and the privilege of social mobility. So moving from poverty into being in a middle class space. And it's really interesting to me to be able to reflect on the experiences of both. And to sometimes when I'm talking to people, and they might be cross with a client, for example, and they'll say they don't care, or they're not motivated, or they don't love their kid enough. And then they describe the scenario. And what some people view as resistance is actually shame, or just simply not understanding that some people do not have the price of the bus to get to an appointment, or they do not have people who will take care of the kids. So it's just interesting to me that you have a whole bunch of people who really want to help others, but sometimes perhaps don't understand the struggles that they have. And I think addiction is a really good example, because we know that wealthy people use more drugs and alcohol than poor people. They spend more money on it, but poor people have much worse outcomes as a result of drug and alcohol use, for 2 reasons. One is the reason why they do it is different. What they need to get from the drugs and alcohol is different. And number 2 is if they get themselves into trouble with their drugs and alcohol, they can't access the supports.
That's right. They can't, they might not be able to call in sick, or have some of those privileges. I'm also thinking about the pushback about this and how that this is so embedded. So I started, like, my father was disabled, my mother was a bookkeeper, and then my partner's family was similar. Public housing, single mom with 6 kids for her. And that's one of the reasons I don't have a PhD is I couldn't afford it. I had to do a master's because I was working. So that's how it ends up looking from that perspective. But especially here, there's so much hostility around pull yourself up by your bootstraps. I did it, so you should be able to do it. Whatever that is around blaming the poor, for sure. If you worked hard enough, if you're on welfare, it's because you're lazy. I mean, these things make me feel terrible even saying them, but this is part of the environment that large communities are living in and internalizing and not being represented. Like, who represents the poor?
Yeah. So when you are living in an environment where there is poverty and you are in poverty, you do think it's your fault because everybody has told you it's your fault. And it's only if you get an opportunity to go to university, for example, that you learn about things like social capital. So, for example, we have a cost of living crisis and electricity is very expensive at the moment. And I have a direct debit. So my electricity bill comes, my money goes out of my account. Now, if you're living in poverty, you can't do that because you have to have prepay electricity. So you buy a card. How it works here, I don't know if you have that in the States, but you buy a prepay card and you stick it in and you have $20 worth of electricity for the week. So per unit, that electricity is about twice as expensive as somebody who's able to have a direct debit. Mm-hmm. So when you're poor, everything is more expensive. If I want to go out and buy a pair of shoes today for my kids, and I go out and I can buy a pair of shoes that are 40 euros. That would be a good quality pair of shoes. They will last them until they grow out of them. If I don't have 40 euros for a pair of shoes for the kids and I only have to go into a cheaper store where you're going to spend 10 euros on a pair of shoes, those shoes will last 6 to 8 weeks. And then I'll have to buy another pair. So from the minute you get up in the morning until the minute you go to bed at night, you never have any money left over because being poor is more expensive than having money. And the other thing about social capital is that, for example, because I work in a university, sometimes if I go to a coffee shop and with my children and I meet somebody who I've met through work or something, they'll say, "Oh my goodness, it's so nice to see you." And they'll give my kids a free hot chocolate. So the woman who's cleaning my office, who's on minimum wage, will go into the same coffee shop, but her kids won't get a free hot chocolate. But the woman who can afford to pay for the hot chocolates gets them for free. So it's little things like that happen on a daily basis that means that when you have money, it's easier to get money and it's easier to get things for free. When you have no money, it's impossible to get money. If you do borrow money, it's from very dubious places that end up charging you huge amounts of money. You can never get ahead then. So to tell somebody to pull themselves up by their bootstraps, they ain't got no bootstraps. They haven't got them, and you need to give them to them so that they can then pull up their bootstraps. There seems to be this thing in the States about being self-made, and there are very few people who are self-made. It's largely a myth. And often the people who are held up as, you could be this guy. No, you can't, because that guy's dad owned an oil company or something. What's really interesting then as well is that the kind of people in the middle, what we call here the squeezed middle. So they're the people who are working really hard. They have some money to go on holidays, but still things are tough. And if they get a medical bill, worrying about that, or where do you get the money to go to college? So what's really interesting is that those people are pitched against the poor people. And what you have is two groups of people who are struggling, and the people who are not struggling, who hoard a huge amount of wealth, are happy to sit back and watch two groups of people who struggle go against each other, because it takes attention away from who's hoarding the wealth and what policies are keeping people in poverty.
I can see that happening in the national climate so clearly, including around immigration and getting folks who have immigrated. There's just definitely this intentional division, can totally feel that, versus inherited wealth or undeserved wealth. Things like that, where it feels like you've made it, but actually, yeah, like you said, your uncle and your brother, using your example about the hot chocolate, not only does yours get a hot chocolate, but probably when they're looking for work, they're going to be more likely to know someone who knows someone who can get them in and be motivated to get them in order to have a relationship with you. That whole social capital piece. The stressor is so powerful.
Psychology is actually a good example, because in Ireland, to become a psychologist, you need to do a psychology degree, then you need to do a psychology master's, and then you have to do a doctorate. Most people have to work for free as assistant psychologists in voluntary roles so that they can get accepted into a doctoral program. The only way you will get that work is if you know somebody who's a psychologist who will let you come and work with them. So if you're a kid in public housing like I was, I didn't know any psychologists. Whereas now, if one of my kids came to me and she said, I'd like to be a vet, or I'd like to be a doctor or a lawyer, I work at a university, I meet loads of people all of the time. And I'll say, oh, you know what, I know somebody in the law department. I'm going to ring them up and see if they can help us out and get you an internship for a month or so. That's social capital. People can't see the value of it because there isn't the dollar sign on it. But that's the thing that keeps you in poverty. They're the bootstraps. They're the bootstraps that you want people to pull up, but they don't have them.
They don't exist.
No. And even things like, if I want to get solar panels for my house because it reduces my electricity bill, I can go to the bank and I can get a loan, which I did last year. Even the solar panel loan, my electricity is still cheaper now because I have those solar panels. If I didn't have the income that I have, I couldn't go to the bank for a loan. I would have to go to a lender that I would be paying it back for such a long time, it would never be worth it. We know that when you're stressed, that it affects how you think. And it affects your ability to think, and it affects your ability to regulate your emotions. So if you're really poor, you're really stressed. So you're not going to be able to pull up those non-existent bootstraps. The reality is the only reason why I have a PhD is because I live in a country where we have free education. There are plenty of people like me all over the world who just won't be able to access that.
So many of these invisible bootstraps that are holding people up, because they're invisible, we don't realize that we're being bootstrapped. And so we attribute it to ourselves, which makes the divide even more. But going back to the stress and the cortisol and the kind of developmental piece around mental health, right? Some of what we're saying, I think, is the parents themselves are in this objectively stressful situation. It's not the parent's reaction to something. It's literally reality that they're going to have more cortisol and be spending a lot of their internal conscious capital on things that aren't only about the child. It doesn't mean they don't love the child. They love the child just as much. But again, the resource isn't there. So the stress is one part. I guess I'm moving back to mental health and what the trajectory looks like from a mental health standpoint. The other thing I was thinking about is even just health, like COVID would inappropriately hit, in particular, indigenous groups, I'm hearing, have a higher rate of death, even though their vaccinations level are the same and things like that. Again, because of poverty and because of all of these pre-existing other health issues that are also part of the picture when we're talking about poverty and the impact of both health issues and mental health issues that add up. And then from your perspective, from a mental health standpoint, what does that look like? And also, what are your thoughts around intervention? Because one of the things we talk a lot about is therapy. We do therapy, but that's an individual action. And we hope with security and talking about security, one person can't be secure by themselves. If the group, if the community isn't looking at reducing stress and increasing safety in a community, then like that, basically mental health care, as we understand it, needs to incorporate systematic change. And I think you'll be much more articulate at speaking about that.
What I've started calling that recently, Sue, is beyond trauma, because I've spent the last few years talking about adverse childhood experiences and trauma and stress, how it impacts on our ability to think and learn, how it impacts on our mental health, how it impacts on our ability to access services. So you might be sitting there and waiting for me to come to an appointment, and I'm really stressed and I turn up and I'm emotionally dysregulated and you perceive me as being angry. But I'm not, I'm really stressed, and this is how I'm presenting it. Now, if you're somebody who understands stress and trauma, then you're going to be curious, you're going to notice that, and you're going to say, Sharon is really stressed, I wonder what's going on. But there are other services that you might go to and they might say, your behavior is inappropriate and unacceptable and you are no longer welcome here. So what happens then is that the people who need access to therapy the most are the ones who are least likely to be able to get it. So they're the people that you see living in tents on the side of the street. And then we blame them for being there without thinking about what happened, what was the trajectory. So the beyond trauma thing, sometimes when some people talk about trauma, they think about nice trauma. And then the person who presents, that can come up and I can come to your office and I can sit there and I can cry and I can share my feelings and I have words to label my emotions. We have this other group of people who are traumatized and it looks terrible. It looks chaotic. It looks messy. It looks out of control. They will tell you to fuck off. They will be standing on the street screaming and shouting. They're traumatized, but they're a group of people that some people don't want to work with, because we have to accept that trauma is messy, trauma is chaotic, trauma is angry, and it's scary and it's frightening. So the beyond trauma then is, I think that we've reached a point where most people know about trauma, what it is, and the impact that it has on thinking and behavior. So now we need to move beyond that awareness piece and say, well, it's great to be aware of it, but we still have these perpetuating cycles. And people who talk about, for example, the cycle of addiction. There's no cycle of addiction. There's the cycle of trauma, the cycle of poverty. That's the cycle of trauma. So we have to start looking at those systems and say, how do we break these cycles? There are people who are resistant to that because they'll say, if you're poor, it's your fault. If you're in addiction, it's your fault. If we don't start to help people who are in those situations, it costs you more money. It makes the place where you live feel more unsafe. So we need to move beyond trauma and start looking at systems and structures. So if you look at the trajectory, and I'm going to take the United States as an example. We're going to pretend that I'm a woman in the United States and that I'm pregnant. And I'm going to compare it with the Irish context. In Ireland, the minute you get pregnant, you are entitled to free medical care, irrespective of your income. Every single woman in Ireland is entitled to free medical care. So all of your scans in the hospital are free. All of your doctor's appointments are free. When you go in to have your baby, that's free. You get charged absolutely nothing. And then when you come home, your baby's developmental checkups are free for the first 3 years. All of their vaccinations are free. Your doctor's appointments are free for the next 6 weeks as well. If you're working here, you're entitled to paid maternity leave for anywhere between 6 to 9 months. So you get paid to stay at home and look after your baby for 6 to 9 months. If you're not working, you're entitled to a state maternity benefit, and you're also entitled to get that for up to 9 months. If I was in the States, I would have none of that. So the minute I get pregnant, if I do not have amazing health insurance and I don't have this really great job, the minute I get pregnant, I'm now heading into super stressed territory, because how am I going to afford my medical appointments? How am I going to take a week off after my baby's been born? In the States, there are some people going back to work 4 or 5 weeks after having a baby. In Ireland, it's illegal to separate puppies from their parent mother because of the impact that it has on the puppy's well-being. But in the States, you take mothers from their babies who are physically and mentally tired, and they have to go out and they have to work to provide for their family. There's the start of your trajectory. So we can talk about mental health and we can talk about attachment, we can talk about all of those things, but we have to talk about the fact that all of those things are made worse by the fact that people live in countries that have policies that don't allow you to have good mental health. I can blame poor people all I want, but we're back to the bootstraps. Where are their bootstraps when all of those policies don't exist? And I know because we get a lot of students from the States who come here for a year to study psychology, and they're just like, how come we don't have to pay for education? I was talking to one of our students the other day, and her brother studied to be a lawyer, and I think he's got a student debt of $100,000. That just wouldn't happen here.
I was teary as you were describing what pregnant woman's beautiful, like the holding that happens for her and for that baby from the beginning, and the exact opposite of that here. Again, the culture and the narrative is entirely different around all of this. And it's like, what is wrong with us? So these changes have to be institutional and political.
And it's not socialism because they're universal benefits. Sometimes people who have power and control and have money can the things that I've described to you in terms of free maternity care and free education, sometimes people think, oh, that's socialism. I live in the Republic of Ireland. We're not a Marxist country. We've had free education here since, I think, the 1970s. So we're not a socialist country. We're just a country that recognizes actually that children and babies in particular are entitled to universal care. So it doesn't matter whether you earn $20,000 a year or you earn $250,000 a year. You are entitled, and your baby is entitled to exactly the same services for free. So we have a child benefit payment, for example. That's a universal payment. So from the minute your child is born until the minute that they turn 18, you get a monthly payment into your bank account. It's a universal child benefit. Every single parent in Ireland gets that, irrespective of their income, because that is a universal benefit for children. So it's making sure that all children have access to the same thing. So once you level that playing field, now you're starting to create bootstraps.
Yeah, those are your bootstraps. Wow, this is just so incredible. And we are moving into the midterms here, and could not be more important to vote your conscience towards human rights and social justice. Now, speaking of ideas about this, I know that you also studied podcasts and potentially the positive impact. So can you say a little bit about mental health and podcasts? As I wipe my tears away about hearing about how it could be, like it's heartbreaking, but go ahead.
And I just want to pause there for a second, because it is heartbreaking, because the United States is quite a wealthy country. There are lots of people there who have a really good education. And I know that there are people in the United States who get to travel a lot. So they will have traveled to Europe and including Ireland. What I've described to you in relation to maternity care and free education is not unique to Ireland. For example, because I'm Irish and Ireland is a member of the EU, my children can access free education in other European countries. And if I went on holidays to France tomorrow, I have a European medical card, so I'm entitled to access the hospital for free, because this is just how it works in Europe. Yeah, so there are people in the United States who have a lot of money and who travel a lot, and they have been to Europe. They know how it works here and the access that people have here to basics, health and education. And how they don't use their voice then to advocate for that in their country is because they would have to pay more tax. So I pay 47% tax on my income. I'm happy to pay that because I also reap the rewards of that, and so do my children. So when I pay that 47% tax, it's not the poor people who are running around having a great time with my money. They are universal benefits, and we all benefit from them. And I'm also happy if the children who have less than my children do get a little bit extra of my money. That would make me really happy too. Mm-hmm. And when you look at countries that are quite wealthy and quite resistant to those models, is the people who are telling you, be careful about universal health, or be careful about free education, be careful about those things. That's Marxist ideology. They're the people who don't want to pay their share. Yeah. And the people who become most frightened of those conversations are those squeezed middle, the people who are going out working and they're saving and they want to get their kids into college. So they get really frightened and they think life is so tough. And if we dip our toe in any kind of social democracy, they'll take away that tiny little bit we have to bring the kids to camp this summer. When actually what happens is your kids' education gets cheaper, your kids' healthcare gets cheaper. And all of the money doesn't go to helping the poor people, it goes to help everybody.
It's about being interconnected and working as a community and bootstrapping one another across.
The people who don't want to do that have way more than you, right. And they're happy. They're happy that you're in the middle and that you're struggling. And then they're using that to make you hate poor people. That's my bit on that. But coming back to the podcast so I have appeared on a couple of podcasts, and I am an academic and I did work in the community with young people before I came back into the university. But one of the things that struck me when I did podcasts was the amount of contact I would get from members of the public afterwards saying, oh, when I was growing up, my dad had a drinking problem and it wasn't discussed outside of the family home. But as an adult, I've struggled a bit with depression. I found it quite difficult in relationships. And when I listened to your podcast, I went, oh my goodness, I think that those experiences are still dictating my life now. I think because when you're a mental health professional, after a while you take for granted your knowledge, but there's such a huge amount of adults out there who might be not living their best selves and they might be struggling, and they think it's because they're a loser, because they haven't thought about or been told that their experiences are not just about their individual self, but their experiences are impacted by family, community, and social policy. So the beyond trauma. I remember speaking to a group of people who were experiencing homelessness, for example. They all had huge trauma histories from childhood, and they would have had chronic long-term homelessness and addiction. And then I talked to them about the impact of stress on thinking and decision making. And it's really profound, because they say, I thought I was a scumbag. I thought I was a loser. I thought that was just my identity, that I'm just not a good person. I'm not a good human. I don't make good decisions. I can't function. I'm a loser. So what you're telling me is that actually these really bad things happened, and then they limited the decisions that I could make. So that was really interesting to me, that with a podcast, you can reach a huge amount of people who are getting access to information that they would never have had before, because they can't access education or they can't pay to go to therapy. So they're getting this information on podcasts. And I could see all of this coming in. And then I saw a newspaper article that was talking about the increase in mental health related podcasts, and were saying, oh, maybe this is a bad thing, because maybe people might self-diagnose, or maybe people might rely on podcasts and not go for help. And I thought that's really interesting, because that's not been my experience of the contact I've had from members of the public. And myself and one of my master's students, Nisha, went and looked at the literature, and there wasn't any. So we said, this is really interesting. We don't know why people are listening to mental health related podcasts. And when they are listening to them, what are they doing with the information? We sent out a survey, and 722 people responded to that. And what we found was that people with lower levels of education and lower income brackets, when they listen to podcasts, what they're getting is mental health literacy. It's reducing stigma and increasing help-seeking behavior. People in the higher income brackets with higher levels of education are also listening to mental health related podcasts, but they're listening to them for different reasons. Some of them have their own difficulties, and they're getting connection and a sense of understanding about their own personal difficulties, but primarily they are listening to them for professional reasons. They might recommend a specific podcast or a specific episode to clients. So it was really interesting that class divide emerged. Men in particular, working class men, who we know have very low levels of mental health literacy and are the group who are less likely to access mental health supports, hugely benefited from it. And it was really important during COVID as well. That came up a lot, that a lot of people felt very isolated and very alone. And when they're listening to mental health related podcasts, it gives them a sense of connection, and it gives them a sense of hope. An additional thing was that there are also people who have dyslexia and perhaps other different people who've experienced a lot of trauma who might find it difficult to concentrate. What they like about podcasts is they can listen whenever they want at a time that works quite well for them. And then they can listen to the same episode 2 or 3 times until they feel like they've totally got it. If I come in for therapy, I might be running late, I might be stressed, I might go in for my session and I might do a good session, but then somebody might give me a piece of information and I might not necessarily hold that information in my head. Whereas if that person has also done a podcast and they've talked about that specific issue on the podcast, I can listen to it 2 or 3 times until I've gotten it. So podcasts are not a replacement for therapy. Podcasts are a way of bringing concepts to people who are resistant to therapy, and then helping them to understand that these emotional distress and the pain that they have, that is something. There are people out there who have experienced it too. There are people out there who will help you, and it is not your fault. So that was probably the most overwhelming thing that came from it. We have a paper published under review, and one of my colleagues, Reagan Murphy, who's a wizard statistician, worked on that one. And then we have another paper where, when you do a survey, you always put in a box at the end that says any other comments. Nobody ever puts anything in there, ever. But we always put it into our surveys. We had 50 pages of data from the any other comments section. So that will be the next paper that we're going to submit. People had a lot to say about how profound it was for them to listen into a podcast and to have had this sense of identity about themselves. I'm a loser. I just constantly mess up. It's just my personality, or they had these beliefs about themselves. And then they get access to this information, which if you've gone to university, you take for granted. But they hear this information for the first time and they go, oh my goodness. So adversity during your childhood can impact the way in which you engage in the world around you. It can impact on the way in which people see you, and it can impact on the way in which services do or do not let you have access.
So beautiful. I've got goosebumps for sure. I heard you on Blind Boy podcast, so I want to mention him. He was fantastic, and that episode was fantastic. As a matter of fact, a listener of ours alerted me to that podcast to find you when we were talking about some of these larger issues related to mental health. So our listeners are feeding us back. Okay, here's the direction. We're listening, and then we're finding you, and then we're amplifying it. Our experience is exactly similar. Ann and I we've been overwhelmed with the stories that are coming in. And it's just such a privilege to be able to bridge things like this. And those words, what you just said around amplifying this message of literacy, like increasing literacy and taking the shame away. That is our most important thing around that these things have happened to you. It's not you. We say, it's not me, it's my amygdala is a tagline we say. But what you're saying is so important and so validating and so inspiring for us to continue, and for, I hope, other mental health. There's so many of them. I was curious, did any particular ones or kinds show up on your study?
Yeah, so I suppose we had predominantly an Irish audience in terms of who filled it in. So Blind Boy was in there, and there's the two Norries. The two Norries are two working class men who came from an area of socioeconomic deprivation. They experienced adversities during their childhood. They both developed addictions. James was a heroin user, and he was homeless, and he was in and out of prison. And Timmy was drinking and gambling and using cocaine. He was involved in a lot of violence, and he was in and out of prison too. They're both now university graduates, because you can go to university here without free education. So Timmy, for example, learned how to read and write in prison. And when he was in prison, then he was diagnosed with dyslexia, and he felt a lot of shame when he was trying to go to school. His mother had really significant mental health issues. We were talking a couple of weeks ago, and just for people who don't understand poverty in kids, so his mother was very stressed and she had very significant mental health issues, and she wasn't able to care for the children. And sometimes there would be violence in the house. Timmy would sometimes wet the bed at nighttime because he was frightened. And his mother couldn't care for him. It's not that she didn't want to, she struggled to care for him. So he would sometimes go to school smelling of urine, and then he would be called the pissy kid. And then because he had undiagnosed dyslexia, he was regularly described as stupid. So that's his trajectory then. So you don't go to college, you don't get a job, nobody around you goes to college, nobody around you works. And actually there's a lot of status involved in crime, because that's who you look up to, because that's who's in your community. During the first lockdown, they were aware of other people that they know who were struggling with recovery, and they decided to set up their podcast, The Two Norries. They came up a lot because I suppose their lived experience is quite profound, and it gave a lot of hope to the people who were most marginalized. And then Blind Boy, the person you mentioned there, Blind Boy, who would be very popular here and internationally, he talks about democratizing psychology. So when I think about that kid, so if you think about Timmy when Timmy was a kid, if he went into school and somebody said, how are you feeling? His mom was really unwell. So she wouldn't have been able to sit down at night time and read a story to him. So that's going to impact on his literacy. He'd undiagnosed dyslexia, so he's not sitting in the library during the daytime reading either. So how do you have words for feelings then, if your literacy is impacted? So Timmy might come into school and you might say, how are you feeling, Timmy? And he might say, fucked up. And then there are people who say, oh, you're not allowed to use that kind of language. But he hasn't got another word. There's no other word, because he has a feeling, but he doesn't have the word for that feeling. If you have a child who's living with a parent who isn't stressed and they come in home and they're upset, like one of my kids was upset the other day because she wanted to do something that she couldn't do. And the feeling that she had was disappointment. And disappointment is quite a horrible feeling. And it can make you quite angry if you don't know how to label it. And you can't chat about it. I'm disappointed, and sometimes you don't get your own way, and that sucks. But sometimes life is just like that. And let's look at all of the other positives. So if you've time to spend with that kid and explain that, then the next time they have that feeling, they go, oh, this is disappointment. I know what it feels like. It's not nice, but I'll survive it. And I know what it is. And I know that I can now look at what the other positives are. But if you just have loads of negative sensations that you can't label, you can't even explain how you feel. So that's one of the really important things about podcasts is the words, just simply the words that it's given. People sometimes are like, I'm 46. I will meet people my age who won't have thought about the fact that disappointment or shame can have a really profound impact on the way you view yourself, on the way you treat yourself, and on the way you might treat others.
It's life-saving and life-changing to be able to have that kind of consciousness. And the examples you gave are beautiful because they're men, like you said, men in particular are benefiting from this. And these are these beautiful 3 men that are being vulnerable and sharing their experience. And none of them are licensed. There are people in the world talking about mental health and helping people in the world on this broad swath that would not otherwise get it. It is beautiful.
It's funny that you brought up about the licensed thing there, because I have been watching this little interaction that's going on Twitter about licensed therapists complaining about a particular individual. But if you take Blind Boy and the 2 Norries, they are not qualified psychologists. They are experts of their own story.
Yeah.
So what they do is they bring in people who are experts. So like the 2 Norries, for example, have had on, Gabor Mate and Bezen van de Kolk, and they're the names you'll recognize from over there, but also equally they have psychologists on from here, addiction workers, mental health professionals, prison governors, politicians. So they interview experts, but because they're from working class communities, they're asking questions that working class communities want the answers to. And they're asking them in a way that when you answer them, the working class community is going to understand what it means for them. And sometimes with knowledge and information, there are gatekeepers. And it happens in psychology where, only mental health professionals should be allowed to talk about mental health. But if somebody's an ethical podcaster, like Blind Boy or the 2 Norries, they will be really careful about what they talk about. And they will not give their personal opinion about a diagnosis or the causes of diagnosis. They will get on somebody who is an expert in that field. So in terms of podcasts, one of the things I do think is that there are a couple of them out there that I would say are not ethical, because there's a lot of people who are very hurt and confused and angry coming out of the pandemic. This happened before when we had the Spanish flu in the early 1900s. It went on for years and it caused a lot of chaos. And as the people emerged from that, you saw a rise in division between groups. So, LGBT people were attacked, Romani gypsies were attacked, and then they moved on to Jewish people. So you had people emerging from a very difficult traumatic experience and being angry and confused. And there were powerful people that were able to tap into that upset and say, well, here's a group of people that are responsible for your problems when they weren't. And it's a little bit scary to see that 100 years later, we're emerging from a pandemic where there's economic instability and climate instability. And we again have groups of people who are playing on our stress and saying the reason why your situation is difficult is because of them people over there, when that's not true.
And you're talking about podcasts in particular, that because there's no regulation, people can say anything they want.
Yeah. So I suppose for me, one of the things that came out of the podcast study was that there were 1 or 2 podcasts mentioned in there that certainly psychologists or mental health professionals would not recommend to people who are feeling vulnerable. So I suppose one of the things I'd like to see here in Ireland would be that perhaps our health department would say podcasts are a useful tool for the development of mental health. Here's some that we validate, because there are 1 or 2, they're not Irish actually, they're from the States.
Oh, that's no surprise. I have him in mind. I don't know, but everyone listening will be filling it in with somebody. Yes.
Yeah, that's not to say that we won't emerge in that space in Ireland. I think we have less of a problem with the division in politics here because we have free education and you have free healthcare. So we have a little bit of it happening here, but it's nothing like what is happening in the UK or in the United States in terms of groups of people really pulling apart from each other, whole families being ripped apart.
Where we're not naming names, is there any reason not to say that showed up on your study that were of concern?
So if I named who they are and the blowback that you get, I could say something like, it's problematic for people's mental health to deliver a particular type of message. And I know that's true by research, and I could say that.
Right.
And then within 5 minutes of me saying that, I could have somebody calling me a pedophile, which is quite a serious thing to call a psychologist.
What you're saying is it's not safe. And that's part of what we're saying, is that these divisions become dangerous, actually.
I feel like I can't speak freely with you now because of the potential impact on my professional reputation and my own personal well-being, because I don't want people calling me a paedophile or a groomer or whatever online, and the impact that would have on my mental health and on my professional reputation. So I can't speak freely about the kind of people who bang on about free speech because of the way that they would not have a reasonable conversation. They wouldn't have a reasonable conversation. They would start calling me names. And if I was really angry, and if I was really stressed, and if I was really lonely, and if I was really isolated, and if I wasn't getting the opportunities that some other people are getting, and somebody came along and gave me the solution by saying, it's them, it's that group, it's their fault. And if I was really stressed, I would definitely need an answer to know that it's not me. And that's what worries me about some of those podcasts, is that the answers that they're giving are not factual. The best way to protect your mental health is not to be involved in hating other groups, because hate is actually really bad for your mental health.
That is beautiful. That is wonderful. I love that statement. So say it again.
The best way to protect your mental health is not by hating other groups of people, because hate is bad for your mental health.
Should be a guiding principle as we go vote, as we tune in to different podcasts, paying attention to what feelings it evokes in you. If it divides, that's a big flag, versus if it can do these things that what you found on your research, where that people were just overflowing with comments about how positive and good it was and how healthy that listening was. And I can't wait. I want to see both of these papers when they come, for sure.
The transgender issue is a good example. So there are lots of people who don't understand what it means to be transgender, what the mental health of people who are transgender, what that's like for them. Before I became a psychologist, I would have known absolutely nothing about it. And if I was really honest, I would go, oh, is it weird? Is there something wrong with them? Have they got a mental health problem? What's going on here? So there's nothing wrong with me having those thoughts. That's curiosity, and it's a lack of information. And then if I go and I get information, then what I have now is I've moved from curiosity to compassion. Just because I don't understand a group doesn't mean that I have to hate them. I just need to be really careful about where I get my information from. Search not just one source, check 5 or 6 different things. And the other thing is, when people give me information, what's their motivation? What do they get from telling me this? Something that we do with our students all the time is say, when somebody says this about a particular group of people, whoever they are, who is saying it? Why are they saying it? And is it true? They're just 3 questions. And maybe it is true, but I will never know if I don't check on my bias, their bias, and go and look at other pieces of information. So I think that one of the things that we need to do is be curious and reach out and get information.
Yes, at this time of fake news, it's like what's real and what's not real. It is great to have guidance around how do you find truth and what feels right and what feels good for you, versus potentially being prey to this intentional division and intentional fear and hatred.
We get a huge amount of information. It's not possible for us to process all of the information that we get. When I was 14, there was no such thing as the internet. You had hours in the day where you weren't bombarded with information. So now you get so much information. How do you know what's true and what's not? Because of that, I think it's quite difficult for us to hold on to ideas and explore them a bit, because the next bit of information is already coming in. What has happened is issues have become binary. Things are either good or they're either bad. So, if you take the transgender issues, so we'll say, if you're compassionate about transgender people, then that means you don't have any compassion for women. And what about women who've experienced sexual violence? So if I'm a woman who's experienced sexual violence, the toilets thing is a good example. I actually don't like using public toilets anyway. It doesn't matter who's in them. I don't like them. I often feel unsafe in them. And it's nothing got to do with whether it's a man or a woman or transgender or whoever it is. I feel unsafe in public toilets. Anyway, so rather than me saying, oh, I can't have transgender people in my toilet, why don't we say instead, because it's not a binary thing, it's not either good or bad, why don't we say, why don't we have toilets that make people feel safe, irrespective of who they are? If you're a woman who's experienced sexual violence, if you're a man, if you're a transgender, if you're non-binary, why can't we have toilets that make everybody feel safe? That's what happens with these conversations, is it becomes only one person can get looked after, and I need my needs met. And you absolutely should have your needs met. But we can also do it for the others too, without taking them away from me. Does that make sense?
It makes perfect sense. It's the same theme of that. It's community oriented, not self-oriented, not holding on to your own acorns.
Or I can say, look, guys, I would like to have a cubicle where you just go in and you go to the toilet and I'm not sharing it with anybody. That's what I'd like, to feel safe when I go to the toilet. I'd like that for everybody, not just for me.
Win-win. You have really wonderful things to say. We're going to link it in the show notes, some of your articles, some of your materials. But how can people reach you? I know people are going to be super excited as they hear you. How do they find you, and what are your socials, and also any other resources you want to refer people to?
Yeah, the 2 podcast for anybody who's experienced homelessness in prison. The boys are from Cork, where I live as well. It's quite a strong accent. Give it a chance and you'll get there. That's a great podcast for the lived experience, and actually for professionals as well, because when we did the survey of the podcast, one of the things that came up was actually that people who were, we'll say, teachers or doctors or nurses were saying, going back to what you said at the start, by, why are those poor people poor? So people in those professions where it's predominantly middle class, when they came across these podcasts, they're going, I had no idea actually that you can't get this if you're poor, or you can't get that, or that this is what your experience might be like. So it has broken down a lot of barriers as well. You don't have to be in recovery to enjoy the 2 You just have to be somebody who cares about other human beings. And totally. Blind Boy. And then I'm on Twitter. I think it's S Lambert 0. It's just Dr. Sharon Lambert anyway. And that's the only social that I'm on. I may possibly switch to Instagram in the next while if Twitter becomes unpleasant, but at the moment I'm doing okay there.
And you said that your paper was published now, or that you had
No, it's the preprint of the podcast papers. That's available on the website of the university where I work, University College Cork. So it's 2022 podcasts as a tool for mental health literacy. So that's up as a preprint, and that's the quantitative data. The qualitative data will be going up in about 4 to 6 weeks.
Wonderful. From Austin, Texas, across the world, you'll be going now in your afternoon, and I will be emerging. The sun's just coming up. It is amazing and wonderful, and been such a privilege. I really appreciate you sharing with us.
Thank you so much. And I want to wish you all the best. And I know that things are really difficult in the States right now for lots of different people. Irrespective of what side you are on, there are lots of people feeling pain. So I hope that there's going to be some healing and some recovery for everybody over there.
Thank you. I hope so too. It's been an honor. Appreciate it.